Good morning, guys. I'm back again with a video for you. I've been getting a lot of questions about anesthesia, how to prepare for anesthesia when you are getting ready for surgery. So I've compiled a couple questions here that people have submitted, and I'm just going to go over them one by one. The first question is, how do you prepare for anesthesia? And I think what they're meaning is any special things that they need to do. So my number one piece of advice would be the day before your scheduled procedure to make sure that you are drinking plenty of water to keep yourself hydrated. Okay, most places will instruct patients not to have anything to eat after midnight. And the reason for that is when you show up to have your surgery, they're going to be instrumenting your airway. So if you just think about what happens when you take your finger and you shove it in the back of your throat, you're gonna gag, you're gonna wanna vomit. So it's very risky to provide anesthesia to someone that has a full stomach because there's a risk of getting whatever is in the stomach into the lungs. So be honest with your anesthesiologist if you've had something to eat or drink, because that's very important and it will affect your anesthetic. Okay, the next question is, what are the different types of anesthesia? The most simple way I can explain this is just to break down that there are, in general, 4 different types of anesthesia. Okay, most people have heard of general anesthesia. That's the type of anesthesia that's simulated often on TV when people are having surgery. General anesthesia basically is going to be the complete loss of consciousness. Okay, so you're not going to feel any pain. You're going to have no awareness of what's going on. And that's usually administered through inhalational gases. It can also be administered actually through IV drip. But when you have general anesthesia, your respirations will be controlled by the anesthesiologist, either by a ventilator or by a bag mask. The second type of anesthesia is called monitored anesthesia care, basically meaning sedation. And so when you have sedation, it's all about a slow titration of medicine to effect. So most people might remember having some type of sedation when they undergo colonoscopy or endoscopy. And because the medicine is slowly given until you kind of lose consciousness, but you're still, for the most part, breathing for yourself, there is a possibility of having brief periods of awareness, and that's actually normal. Most people, when they're getting sedation by an anesthesiologist, is a deep sedation, and they're not aware of the procedure that's going on. The third kind of anesthesia would be neuraxial anesthesia, which includes epidurals and spinal anesthesia. Most people are familiar with epidurals because of moms. When they go into labor, a lot of times there's requests for an epidural. And essentially, when you're placing an epidural, you are putting medicine in the space right before you enter the spinal canal where there's cerebral spinal fluid. And so that medicine will be placed through a catheter so that you can have medicine continuously and be comfortable for labor. It can also be used for any type of peripheral or lower extremity surgery. If you're having foot, ankle, knee, or hip surgery, you can use an epidural for that as well. Most commonly, when you're having surgery, though, a spinal anesthetic is chosen over epidural. Just because you get a lot of times you get a little bit of a denser block, and it's used primarily again for lower extremity, with the exception of cesarean section, which is abdominal surgery. The drawbacks of spinal anesthesia is that generally it is a one-shot injection. And because it's a one-shot injection, that medicine is gradually metabolized from the moment that it's given. So generally it lasts about 2 hours. So if you have surgeries that are longer than that, usually they'll opt for general anesthesia in lieu of a spinal because they'll start to wear off. The fourth type of anesthesia would be regional anesthesia, and that would include peripheral nerve blocks. So we have the ability to anatomically locate the nerve bundles that provide motor and sensation to the upper extremities, to the lower legs, and we can do a one-shot injection of local anesthetic that will essentially put that limb to sleep for 12 to 24 hours. That type of anesthesia can be used by itself, but oftentimes it is coupled with general anesthesia and used for postoperative pain management, or is coupled with MAC or sedation that I mentioned earlier. Let's see. Should I take my medications before surgery? So for these type of questions, I always would like to say, please speak to your doctor. What I'm telling you here is just general rule of thumb. It should not serve as medical advice. If you have a specific medication that you take, please talk to your doctor about what medicine should and should not be taken. But as a general rule of thumb, most of your medicines are okay to take before surgery with a sip of water, with the exception of some hypertensive medicines can cause your blood pressure to be low during surgery, like ACE inhibitors like lisinopril or enalapril. So sometimes people are instructed to hold them for the day of surgery. And also blood thinners are usually told to stop those depending on what it is. It could be up to a week ahead of time. But again, there are a lot of different blood thinners, and so you need to talk to your doctor about specific instructions of when those medicines should be held. Let's see, what is the last one? There was one more question. Are there any side effects that come from anesthesia? So the answer to that is yes. Fortunately, most of them are mild and not severe. The most common side effects after having anesthesia would be nausea, vomiting. This is a side effect of the inhalational gases, as well as any narcotics that may have been used for pain control can also cause you to be nauseous and want to vomit. Excuse me. Sore throat, muscle soreness, shivering. Of course, you're going to be a little bit sleepy and lethargic after having anesthesia. There are some individuals who have a genetic predisposition to having severe reactions to anesthesia. Those include conditions like pseudocholinesterase deficiency, which is very rare, fortunately, in the general population, but those people metabolize muscle relaxants differently, and so can have prolonged paralysis that can't be reversed when they get certain medicines undergoing anesthesia. And also there is a condition called malignant hyperthermia that can be a life-threatening reaction to anesthesia. So it's important when you are talking to your anesthesiologist to give them a thorough history of all of your medical conditions, any family history of bad reactions to anesthesia, so that they can properly assess you and form an appropriate anesthetic plan for you. If you guys have any other questions about anesthesia that you would like me to answer, please comment down below and I will try to get back to them as soon as possible. Thanks, guys. Have a great day.